everyone, it's Jasmine, and today's video is all about bipolar disorder. So I hope you learned something today, and let's get started.
What is bipolar disorder? Bipolar disorder is a mental health condition characterized by extreme mood swings. These shifts include emotional highs, which we call mania or hypomania, and emotional lows, depression. Bipolar disorder affects around 1 to 2% of the population worldwide. It can also be known as manic depressive illness and can impact daily life, relationships, and jobs. Now, there are different types of bipolar disorder, each with its own symptoms and severity. Bipolar 1 disorder is characterized by manic episodes that last at least 7 days, or by manic symptoms that are so severe that immediate hospital care is needed. Depressive episodes also occur with bipolar 1 disorder. Then we have bipolar 2 disorder, which is characterized by a pattern of depressive episodes and hypomanic episodes, which are less severe than manic episodes. But in bipolar 2 disorder, we do not see these full-blown manic episodes that define bipolar 1 disorder. Finally, we have cyclothymic disorder, otherwise known as cyclothymia, where periods of hypomanic symptoms as well as periods of depressive symptoms last at least 2 years. But these symptoms do not meet the diagnostic requirements for a hypomanic episode and depressive episode. Now, if we look at the symptoms of mania and hypomania, mania involves an extreme elevated mood and increased energy levels. Common symptoms of mania include inflated self-esteem or grandiosity, decreased need for sleep, being more talkative than usual, having racing thoughts, and having increased risky behavior. Hypomania is a milder form of mania, but it can still affect functioning, and the symptoms are similar to the ones I just listed, but again, they're less severe. Now again, depressive episodes can occur, and symptoms may include persistent sadness or feeling empty, a loss of interest in activities that one once enjoyed, fatigue or loss of energy, difficulty concentrating or making decisions, thoughts of death or suicide, and sleep and appetite disturbances. Now, moving on to bipolar disorder causes and risk factors. The exact cause of bipolar disorder is not fully understood, but it's believed to be due to a combination of factors, which can include genetics, as bipolar disorder tends to run in families, biological differences, as people with bipolar disorder often have physical changes in their brains, neurochemistry, involving imbalances in neurotransmitters such as serotonin, dopamine, and norepinephrine, and environmental factors including stress, trauma, or major life changes, as these can trigger episodes of bipolar disorder, especially in genetically predisposed individuals. Now, how do we diagnose bipolar disorder? Often, bipolar disorder is diagnosed through a clinical interview where a mental health professional will assess the person's mood history, behaviors, and medical background. Mood tracking, where a diary or journal is kept of mood swings to help in diagnosis. And when other conditions are ruled out, as doctors must rule out other mental health disorders and medical issues that may be causing similar symptoms. There are options available to treat the symptoms of bipolar disorder, which can include medications, such as mood stabilizers, for example, lithium, antipsychotics, including olanzapine and quetiapine, and antidepressants, which must be used cautiously with mood stabilizers. Psychotherapy is another great treatment option to address the symptoms of bipolar disorder and can include cognitive behavioral therapy, interpersonal and social rhythm therapy, and family focused therapy as well. Lifestyle and support is very, very important to address the behaviors that we take in every day to treat symptoms of bipolar disorder, including making sure we have regular sleep patterns, we have techniques to manage stress, and we have support groups available as well. Living with bipolar disorder can be challenging due to the stigma that many people with bipolar disorder face, which can lead to isolation and reluctance to seek help. Financial impacts, as the disorder can affect your work performance and financial stability due to fluctuations in mood and energy levels, and risk for substance abuse, as some individuals may self-medicate with drugs or alcohol to cope with emotional highs or emotional lows. It's for this reason that as family members and friends of those living with bipolar disorder, that we create a supportive environment that is cohesive for the individual to seek support and ask for help when needed, and we check in with them consistently to make sure they're receiving the help and support that they need. In all, bipolar disorder is a complex mental health condition that affects mood, energy, and daily functioning. With early diagnosis, appropriate treatment, and strong support systems, individuals can lead fulfilling, productive lives. By increasing awareness, reducing stigma, and encouraging open conversations about mental health, we can foster understanding and compassion for those living with bipolar disorder. Thank you for watching.